All right, welcome back to the deep dive. Today we're going to be looking at strokes.
Ooh, interesting.
Yeah, we've got this nursing lecture that we're going to be diving into.
Cool.
And it should be pretty fascinating to see, how the brain works, what happens when things go wrong,
Right.
and how medical professionals are approaching this.
Yeah, and you know what's funny is that the lecture just starts off with this simple definition,
Uh-huh.
a disruption of blood flow
Okay.
to or within the brain tissue, but it has such profound implications.
Yeah, it really does. Like, it's almost like a domino effect, I feel like.
Yeah, exactly. Think about it. Brain cells, super energy hungry,
Right.
need oxygen, they need glucose.
Yeah.
And when that supply gets disrupted, even for a short period, those cells
They're in trouble.
they're in trouble, and they can even die off.
Yeah.
And that's when we see those physical, cognitive, and even emotional implications
Right.
of a stroke.
Okay, that makes total sense. Now, the lecture dives into the three different types of stroke: ischemic, transient ischemic attack, or TIA, and hemorrhagic. And it seems like, understanding the difference between these three is crucial.
Absolutely. It's not just blood flow, it's about the why.
Okay.
So ischemic strokes and TIAs, both caused by blockages in the blood vessels, kind of like a traffic jam.
Okay.
But with a TIA,
Yeah.
it's temporary.
Oh.
So it's a brief fender bender, traffic slows down, but eventually gets moving again.
Gotcha.
Now, ischemic stroke, that's a major pileup.
Oh, okay.
That's causing lasting damage.
And then there's hemorrhagic stroke.
Right, hemorrhagic stroke. Instead of a blockage, we're talking about a leak.
Okay.
A blood vessel in the brain ruptures and blood spills out, and it's damaging the surrounding tissue.
Wow.
Like a burst pipe. And just like with plumbing, got to contain that leak
Yeah.
to minimize the damage.
Quickly. So it's not just about the blood flow, it's also about the integrity of the pipes themselves.
You got it. And that's why recognizing the type of stroke is so crucial.
Yeah.
Because it dictates the entire treatment strategy.
Makes sense.
Totally.
Now, the lecture gives us this whirlwind tour of the brain,
Yeah.
which is super fascinating just in its own right.
Oh, for sure.
Like, one of the things that gets me is how the cerebral cortex, which is the outermost layer of the brain, is folded
Yeah.
to maximize surface area.
It's incredible, right? How much
Yeah.
processing power we pack in.
It's like nature was like, we need more room for these smarts.
Right.
But that also makes you wonder, like, what happens when there's a stroke?
Right.
And it disrupts those folds.
Yeah, exactly.
Yeah.
And that's where understanding, the specific area of the brain that's affected becomes so important.
Right. So, like, each region having its own unique role.
Right.
The lecture mentions the frontal lobe
Yeah.
being responsible for planning, decision-making, and personality.
Mm-hmm.
So, like, if that area is affected by a stroke, that could impact those things.
Exactly. It's like different departments in a company
Yeah.
with their own special role. One goes down, it can disrupt the whole operation.
That makes sense. So let's shift gears a little bit and talk about how blood actually gets to the brain.
Okay.
The lecture highlights these internal carotid
Yes.
and vertebral arteries
Yeah.
as being the main highways.
And this is where it gets really interesting.
Okay.
The brain has this amazing safety net called the Circle of Willis. This is a network of interconnected arteries. It's like a backup system.
Wow. Okay.
So if one of the main highways gets blocked,
Yeah.
the Circle of Willis can reroute,
Like a detour.
like a detour around a traffic jam.
So it's like a built-in redundancy system for the brain.
It is.
Yeah.
But even with this backup, time is critical
Right.
when it comes to treatment.
Mhm.
The lecture emphasizes that neurological function.
Mm-hmm.
It starts to decline within seconds
Oh.
of stroke, and cell death
That quickly.
begins in just minutes.
Wow, minutes. So recognizing the signs of a stroke and then getting medical attention like right away
Yeah.
is super
Yeah.
important.
Absolutely. Every second counts when it comes to saving brain tissue.
You're right. And speaking of signs, the lecturer gives this helpful acronym to remember:
Yes.
FAST.
Fast.
I've heard of this one. So F for face drooping,
Yeah.
A for arm weakness,
Uh-huh.
S for speech difficulty,
Yeah.
and T for time to call 911.
The call 911. That's right.
It's simple, but it's a life-saving tool.
It is. It helps people assess whether someone might be having a stroke,
Mm-hmm.
and it emphasizes the urgency of getting medical attention.
Right. The faster the treatment, the better the chances of recovery.
Exactly.
Now, the lecture also goes into the different risk factors that can make someone more likely to have a stroke.
Right. And, a lot of these risk factors we've heard about in terms of overall health.
Yeah, for sure.
Age, diabetes, heart disease,
Yep.
hypertension, and smoking.
Yeah, it's like all these different factors converge.
They all converge
To impact brain health.
to impact brain health.
So it's not just about addressing stroke risk.
Right.
It's about being proactive and protecting our brain health long term.
Exactly.
Wow, this is fascinating.
Yeah, it is. It's a lot to take in, but it's really interesting how these things are all connected.
Totally. I'm excited to keep diving in.
Yeah, me too. You know, it's amazing how much we can learn about something as complex as a stroke from a nursing lecture.
Right. It really is. It's like peeling back the layers of an onion.
Yeah, it is. And this lecture, it doesn't shy away from the complexity.
Right.
Especially when it comes to like understanding all the different parts of the brain and how they're all interconnected.
Yeah.
So it starts by explaining like the central nervous system
Okay.
versus the peripheral nervous system.
Okay.
So the central nervous system is like the command center, right?
Gotcha.
The brain and the spinal cord making all the executive decisions.
Okay.
And then you have the peripheral nervous system.
Yeah.
That's that vast network of nerves branching out, carrying messages back and forth.
So it's like a two-way communication system.
Exactly. Like imagine a bustling city. You've got the central hub
Right.
and then a network of roads connecting everything.
Yeah.
Central nervous system is that hub.
Okay.
Peripheral nervous system is that network,
Makes sense.
constantly relaying information and instructions.
Okay, so then within the brain itself, we have all these different areas, each with their own unique role.
Right. The lecture mentions the cerebrum, the hypothalamus, the pituitary gland.
Yeah.
It's like a city with all these different neighborhoods, each with its own unique function.
Yeah.
You've got like the financial district, the industrial zone, the entertainment area,
Yeah.
all working together to keep the city running.
But like in a city, if one neighborhood is disrupted,
Yeah,
it impacts the whole system.
exactly. And that's why it's so important to understand not just what a stroke is,
Right.
but where it occurs
Okay.
in the brain.
Yeah.
Like the location. That determines which functions are going to be affected.
Right. So like if a stroke affects the left side of the brain,
Yeah.
which controls language for most people,
Right.
that could lead to speech difficulty.
Exactly. And a stroke on the right side might affect spatial awareness
Wow.
or emotional processing. It's incredible how specialized the brain is
It really is.
and how a stroke in one tiny area
Mm-hmm.
can have such widespread effects.
Yeah, that's wild.
It is.
Now, speaking of how vital blood flow is to the brain,
Yeah.
the lecture explains, you know how blood gets there?
Mm-hmm.
Through those main pathways, the internal carotid and vertebral arteries.
Right.
And then we have that circle of Willis
Yeah.
stepping in as that backup.
It's like a roundabout
Yeah.
at a major intersection.
Okay.
So if one road's blocked, traffic can still flow
Wow.
through the roundabout.
So it's like the brain has its own little detour system?
It does. But it's not just about getting blood to the brain.
Okay.
It's about getting it through the brain.
Right, okay.
So we're talking about this intricate network of arteries
Yeah.
branching off from those main pathways.
Okay.
And each one is supplying blood to specific regions,
Gotcha.
like a city's network of streets and alleys,
Yeah.
making sure every corner gets his deliveries.
Right. So, like, if there's a blockage in one of those smaller arteries,
Exactly.
even if those main pathways are clear,
Yes.
that can still cause problems.
Exactly. It can have very specific effects depending on which area
Oh, wow.
of the brain it's supplying.
Okay.
It's like a delivery truck getting stuck in an alley.
Right.
Shops on that street won't get their goods.
Makes sense.
And then the lecture also talks about venous drainage.
Mm-hmm.
So how blood is carried away from the brain,
Okay.
like the sanitation system of a city.
Okay.
Just as important as that delivery system.
Right.
Waste isn't removed efficiently. It builds up, causes problems.
So it's like this constant two-way flow
Yes, two-way flow.
of blood in and out of the brain.
Keeps everything running smoothly.
Gotcha. So if anything disrupts that flow,
Mm-hmm.
whether it's a blockage or a bleed,
Mm-hmm.
that can lead to those serious consequences.
That's why understanding the factors that can affect that cerebral blood flow is crucial.
Right. So the lecture mentions a bunch of factors.
Yeah.
Blood pressure, cardiac output, viscosity of the blood, intracranial pressure.
Mm-hmm.
Seems like a lot to keep track of.
It is. Think of it like a delicate ecosystem.
Okay.
For the brain to function right, all these factors need to be in balance.
Okay, so like if blood pressure is too high,
Yeah.
that could put stress on the blood vessels
Like
and lead to a hemorrhagic stroke.
Right, but if it's too low,
Yeah.
there
Yeah.
might not be enough force to like push the blood through
Oh, wow.
to nourish the brain cells.
And then there's cardiac output.
Yes, cardiac output.
How much blood the heart pumps per minute?
If the heart's not working right,
Yeah.
that impacts blood flow.
Okay.
Like a weak pump trying to push water through a long hose.
Okay.
Struggles.
And then viscosity of blood.
Viscosity, yes.
How thick or thin it is.
If it's too thick, it's like trying to push honey through a straw.
Yeah.
It's going to move slow. It might even get stuck.
Right.
And then intracranial pressure.
Intracranial pressure.
That's a crucial one. The pressure inside the skull,
Okay.
if it gets too high, it compresses the brain.
Oh, wow.
Restricts blood flow.
Okay.
It's like squeezing a sponge, making it harder for water to flow through.
So many factors.
That's a lot. And the lecture goes on to explain how certain conditions can disrupt this balance.
Okay.
So like atherosclerosis.
Okay, yeah.
That's a big one.
I've heard of that.
Yeah, the buildup of plaque in the arteries.
Right.
It's like fatty deposits building up in the pipes.
Right.
Narrowing the passageway.
Yeah.
Making it harder for blood to flow.
And I've usually heard that in relation to like heart disease.
It is.
But it can affect the brain too.
It can affect the brain too.
Oh, wow.
It's a major risk factor for both ischemic and hemorrhagic stroke.
Okay.
And then you have arteriovenous malformations, or AVMs.
Right.
Abnormal tangles of blood vessels in the brain.
Okay.
So instead of these neatly organized roads, you have these chaotic intersections.
Oh, wow.
Prone to traffic jams or even accidents.
Right.
They can weaken and rupture, and that leads to bleeding in the brain.
Wow.
Those hemorrhagic strokes we talked about.
So it's not just blockages.
Right.
It's also about the structure of the vessels themselves.
Precisely. And the lecture highlights some other interesting factors
Okay.
that can impact cerebral blood flow, like changes in carbon dioxide and oxygen levels.
Wow.
Even something as simple as holding your breath for too long
Really?
can disrupt that balance.
That's wild. So sensitive.
It is. And that's why prevention is key.
Yeah.
If we can manage the factors that can disrupt cerebral blood flow, we can reduce the risk of stroke significantly.
That brings us to the risk factors themselves.
Yes.
And the lecture gives this whole list. And it's amazing how many are things we can control.
We can, absolutely.
Right.
We can't stop time. We can't change our genes.
Right.
But we can make lifestyle choices.
Yeah.
Quit smoking, maintain a healthy weight, manage blood pressure, cholesterol, and staying physically active.
Yeah. So it's empowering.
It is.
To know we can take steps to protect our brain health.
We can.
It's not just fate.
It's not. It's about making choices.
Yeah.
And one risk factor that the lecture highlights is atrial fibrillation.
Okay.
Which is this type of irregular heartbeat.
Yeah.
You might be thinking, what does that have to do with the brain?
Right.
Well, when the heart's not beating properly, it increases the risk of clots forming.
Okay.
And those clots can travel from the heart to the brain, causing a stroke.
So it's a reminder that everything is connected.
Everything's connected.
Now, the lecture delves a little deeper into the different types of ischemic strokes.
Yeah.
Thrombotic and embolic.
So think of it this way.
Okay.
In a thrombotic stroke, the clot forms in a blood vessel in the brain.
Okay.
Like a traffic jam right there on the highway.
Gotcha.
Now, embolic stroke, the clot travels from somewhere else.
Huh?
Like the heart lodges in a brain blood vessel.
Right, like a piece of debris floating down the river.
Exactly. And gets stuck.
Yeah.
And this distinction is important.
Okay.
Because it guides treatment decisions.
Now, we talked about TIAs briefly earlier.
We did.
But the lecture goes into a little bit more detail about these transient ischemic attacks.
They're sometimes called mini strokes.
Right.
But that can be a little misleading.
Okay.
Because while the symptoms are temporary, they are serious warning signs.
So it's like the brain's flashing a warning light.
Exactly. It's like, hey, pay attention, something's not right.
Right.
Temporary blockage in blood flow.
Yeah.
The symptoms, sudden weakness, numbness, vision problems, difficulty speaking.
Okay.
They usually resolve pretty quickly. But a TIA is often a precursor to a full-blown stroke.
So it's like a dress rehearsal.
It is.
For the main event.
Yeah, don't ignore it.
Yeah.
The lecture really stresses that TIA should be treated as emergencies.
Wow.
It's an opportunity to identify the cause and take steps to prevent a more serious stroke.
So it's a reminder our bodies are sending us signals.
They are.
We got to pay attention.
You got to pay attention.
And get help when something's not right.
Exactly. And speaking of signals, the lecture dives into the various symptoms of a stroke.
Right.
Reminding us of that acronym, FAST.
Right. FAST.
Face drooping, arm weakness, speech difficulty.
Time to call 911.
Time to call 911. It's amazing how such a simple tool can help people recognize a stroke and take action.
And it goes beyond just the FAST acronym by explaining how the symptoms can vary.
They do?
Depending on what side of the brain is affected.
Depending on the side.
So it's not just about recognizing something's wrong.
Right.
It's about paying attention to those specific symptoms.
Right. Exactly. It's like giving medical professionals a detailed map of the problem area. And that helps tailor the treatment.
Right. So like if someone's having trouble speaking, could point to a stroke affecting that left side of the brain.
The left hemisphere, right?
Yeah.
Which is dominant for language in most people.
Okay.
So once a stroke is diagnosed, the race is on to get treatment started quickly.
Right.
Because as the lecture emphasizes, time is brain.
Yeah.
The longer the brain is deprived of oxygen, the greater the potential for damage.
Wow. So every minute counts.
Every minute counts.
To restore that blood flow and minimize the consequences.
Precisely.
Wow.
So the lecture breaks down the treatment into different approaches for ischemic and hemorrhagic stroke.
Okay.
Seems pretty complex.
It does.
So for ischemic strokes, the goal is to restore that blood flow quickly.
Yeah.
And one of the key interventions is thrombolytic therapy, using that clot-busting medication we talked about, TPA.
Right, like sending in a specialized team to break up that blockage and get the traffic moving again.
Exactly. But you remember how we said TPA?
Yeah.
It has that limited window.
Right.
Ideally, it's administered within 3 hours of the onset of symptoms. Sooner the better.
Okay.
The lecture mentions a goal of door needle time
Yeah.
of 60 minutes or less.
So it's a race against time.
Is.
And highlights the importance of that emergency response system.
Yeah, and beyond TPA, other medications might be used to manage ischemic strokes.
Okay.
Antiplatelets, like aspirin, that can help prevent future clots.
So it's not just about addressing the immediate problem, it's about preventing future ones as well.
Exactly. And then there are the cases where medication isn't enough.
Right.
You have surgical options, like carotid endarterectomy, which removes plaque from the carotid arteries in the neck.
So like giving those arteries a good cleaning?
Exactly.
Yeah.
Now for hemorrhagic strokes, where a vessel's ruptured, the focus shifts to controlling the bleeding. And reducing pressure on the brain.
Right.
So instead of unclogging a pipe, it's more about patching a leak.
Yeah.
So medications to manage blood pressure are often used.
Okay.
And sometimes surgery is needed to repair the ruptured vessel.
So different tools for different problems.
Different tools for different problems. And it's important to remember, stroke care doesn't end with addressing that initial event.
Right.
It's about providing care that addresses the wide range of challenges.
Right, because it can affect so much more than just physical movement.
It can.
Speech cognition.
Yeah.
Emotional well-being.
Absolutely.
Even things like swallowing, bladder control.
And that's where a multidisciplinary team comes in.
Okay.
Doctors, nurses, physical therapists, occupational therapists, speech-language pathologists.
Wow.
All bringing their expertise to the table.
So it's like assembling a special task force to tackle the stroke from all angles.
And the lecture emphasizes how important it is for this team to work together seamlessly, communicating effectively, coordinating care to ensure the best outcome.
Now, the lecture goes into those nursing considerations.
Yeah, yours is.
For caring for stroke patients.
They are the unsung heroes of stroke care.
Yeah.
Often the first line of defense,
Okay.
recognizing those subtle changes in a patient, alerting the medical team.
Wow, so they're like vigilant guardians.
They are.
Constantly watching.
And beyond monitoring for complications, nurses play this key role in providing that supportive care.
Right.
Addressing the physical, emotional, and even psychosocial needs.
So what does that look like in practice?
Everything from helping with basic tasks, like bathing, dressing, to emotional support, encouragement.
So it's about treating the whole person.
It is.
Not just the medical condition.
The lecture outlines specific nursing interventions that can promote healing.
Yeah.
Like repositioning to prevent skin breakdown.
That makes sense, right? If someone can't move easily.
They're more prone to pressure ulcers.
Right. Okay.
And then there's range of motion exercises to maintain mobility, prevent muscle stiffness.
Keep those joints moving.
Exactly.
Yeah.
And then managing bowel and bladder function.
Right.
Which can be affected by a stroke.
Yeah, because a stroke can disrupt those signals, controlling those functions.
Exactly. So nurses play a key role in implementing strategies to promote those regular bowel movements.
Right.
Manage incontinence.
Which can be distressing, right?
It is.
And affect someone's dignity.
Absolutely. And then clear communication.
Right.
With stroke patients, especially those who might have difficulty speaking or understanding.
Right, because a stroke can affect language processing, right?
Exactly. Leading to things like aphasia.
Okay.
So nurses need to be skilled at using those alternative forms of communication. Visual aids, gestures, writing things down, finding ways to connect, even when words fail.
And beyond communicating with the patient, there's also educating the patient and their families.
Yes. Knowledge is power.
Yeah.
Empowering them with information helps them feel more in control.
So they can take an active role.
Exactly.
In their own recovery.
And that's where nurses really shine.
Yeah.
Educators, advocates, compassionate caregivers, all rolled into one.
This has given us a multifaceted view.
It has.
Of stroke, from how the brain works to the different types, to the urgency of treatment.
Absolutely.
And then that comprehensive approach to recovery.
And, before we wrap this part up,
I
have a question.
Okay.
The lecturer mentioned a CT scan should be done in 25 minutes.
Yeah.
And read within 45 of a suspected stroke. Why is that time frame so crucial?
Yeah. What's happening in those minutes?
Yeah, what makes them so important?
That makes such a difference.
Those minutes represent the window of opportunity to salvage brain tissue.
Okay, so limiting that damage.
Yes, limiting the damage.
But what's the mechanism behind that?
What's known as the ischemic cascade.
Okay.
So when blood flow to a part of the brain is disrupted, a series of events unfold at the cellular level that can lead to cell death.
So it's a chain reaction happening.
It is. Imagine a factory suddenly losing power.
Okay.
Machines grind to a halt. The lines stop. No quick restoration of power. The operation crumbles.
Yeah. Okay, I get that.
Essentially what's happening in the brain during a stroke.
So what's the first domino to fall?
Lack of oxygen and glucose.
Okay.
Which are the brain's fuel.
Right.
They can't produce energy without it.
So it's starving the brain cells.
Starving the brain cells.
Wow.
And as energy dwindles, a cascade of events starts.
Okay.
Cells swell. They lose their ability to regulate fluids. And this swelling restricts blood flow even more.
So it's this vicious cycle.
It is a vicious cycle.
Okay, so what happens next?
Brain cells start releasing toxic substances.
Oh, wow.
Excitatory neurotransmitters, free radicals, damage neighboring cells.
So it's spreading.
It's spreading.
Wow.
And if blood flow isn't restored, this leads to cell death.
Okay.
Irreversible cell death.
And permanent damage.
Permanent damage.
Wow, a lot happening.
A lot happening.
In a short amount of time.
So those 25 minutes for the CT scan, the 45 to read it, are all about identifying the stroke.
Okay.
So treatment can be started
to
interrupt that cascade.
Wow, that's incredible.
Those minutes are precious.
Yeah.
They're the window of opportunity to minimize damage.
Powerful reminder for us all.
It is.
To be aware of the signs.
Yes.
Seek medical attention immediately.
Every second counts.
Wow.
We've covered a lot of ground.
We have.
In this part of our deep dive. I think it's time to take a breath. Okay. And shift our focus to the recovery.
Okay.
Join us next time.
All right.
As we explore the amazing resilience of the human brain.
Awesome. Looking forward to it. Welcome back to the deep dive. As we wrap up, I'm thinking about how complex the brain is and how long that road to recovery can be.
Yeah. It really is a journey.
It is.
It takes so much strength and resilience and support,
Absolutely.
But one thing we haven't fully explored is the brain's ability to heal and adapt.
Right. The lectures mention this thing, neuroplasticity.
Oh, yeah.
It sounds like sci-fi to me.
It kind of does.
But it's real.
It's a real thing.
So what is neuroplasticity?
It refers to the brain's ability to rewire itself.
Okay.
Form new connections and pathways, even after injury.
Wow.
It's like the brain has its own little repair crew.
So even though a stroke can cause damage, the brain doesn't just give up.
It doesn't give up. It's looking for workarounds.
Right.
And that's where rehabilitation comes in.
So it's like giving those repair crews the tools they need.
Exactly. Rehabilitation's a multifaceted approach.
Right.
Tailored to the individual patient. Think of it as a team of coaches.
Okay.
Each one helping the stroke survivor train.
Gotcha. So the lecture mentioned physical therapists.
Yeah.
Occupational therapists.
Right.
And speech-language pathologists.
Right. So physical therapists help with strength, balance, coordination, and mobility.
Okay.
Occupational therapists are focused on helping patients regain independence in everyday activities.
Right, so like
dressing, bathing, cooking, even driving.
Wow, so many things.
And then speech-language pathologists.
Yeah.
They work with patients who have difficulty speaking.
Right.
Understanding language, reading, writing.
So many different aspects.
A lot of different pieces.
To this recovery process.
It's really a personalized approach.
Yeah.
It's not one size fits all.
Right.
It's about working with the person's strengths, setting goals, and celebrating those milestones.
And it's not just about regaining what was lost.
Right.
It's about learning new ways to do things.
Absolutely.
Adapting to maybe some lasting effects.
And ultimately maximizing their quality of life.
Right, because their life may look different.
It might.
Than it did before.
It's about adaptation as much as restoration. Finding new ways to live a meaningful life.
Yeah. Now, the lecture also mentioned the emotional and psychological impact of having a stroke, which I can imagine would be significant.
It is. It's a life-altering event.
Yeah.
It's natural for survivors and their loved ones.
Right.
To feel a whole range of things.
Absolutely.
Fear, sadness, grief, frustration, even anger.
Right. So it's not just about the physical healing.
It's not. It's about the emotional and psychological healing, too.
And that's where
support groups, therapy, counseling come in.
Right.
They provide that safe space to connect.
Yeah. With other people who get it.
Who understand.
Yeah.
Share experiences. Learn coping mechanisms.
It's about having that community.
It is.
Of support.
And it's not just emotional support.
Yeah. What else is there?
It's also about those practical challenges.
Okay.
So, depending on the stroke, some survivors might need help.
Right.
Cooking, cleaning, transportation, managing finances.
Wow.
Or even returning to work.
So it's about that support system, too.
It is. It takes a village. And that's where social workers, case managers, community resources can help.
Right, providing that support.
They can connect survivors and families to the services they need.
So building a bridge back to their life.
Exactly.
Even if it looks different.
And the lecture emphasized this.
What's that?
Stroke recovery is a journey.
Not a destination.
It takes time and patience and support.
It's not a sprint, it's a marathon.
Exactly.
And it looks different for everyone.
It does.
Some people recover a lot of function. Others face bigger challenges.
Yeah.
But no matter what.
No matter what.
It's about celebrating those small wins.
Yeah.
Acknowledging the challenges. Never giving up hope.
Well said.
This deep dive has really given us a view of stroke.
It had.
From how the brain works to the different types, the urgency of treatment.
Absolutely.
And then that approach to recovery.
It's been an incredible journey.
It has.
And I hope our listeners understand strokes better. The importance of early intervention and that compassionate approach to recovery.
Couldn't agree more. Thank you all for joining us on this deep dive.
Thanks for listening, everyone.
We hope you found it enlightening and empowering.
And maybe even inspiring.
Until next time, stay curious, keep learning.
And remember, even in the face of adversity, the human spirit can adapt, grow, and thrive.
And that's a wrap on another deep dive.